Oh.
They really like Earl.
Yeah. Yeah, sorry, they kind of do. Or they hide it well. I don't know. So, we gave you a quiz. I don't know if you guys, you're going to have them do the quiz first or what you want to do. That's a microphone, so it's picking up whatever you do and following you around. So, yep. So there you go. So
Okay.
I'm going to turn it over to you guys. And
Perfect, thank you. Okay, so maybe we can take the first couple minutes to do the pre-test on our own, and then we can go over the answers, which we have on the PowerPoint. Just take a couple minutes and fill that out, and we'll go over the answers during our presentation. Do you have them? Does everyone have a pen, pencil?
I left it on the other
Okay, no, it's fine, we got it. Can I steal this one?
Yeah.
Do you, oh, do you need
We
to?
can share this.
Are you sure?
I can
Okay.
go first and she can go second.
Okay, great. Maybe we should record during this one.
okay, yeah.
I don't have a headache. My blood pressure is at an acceptable level. True or false? What do we think? False. That is correct. Oh, I don't know which way. Oh, technology. Okay. Ermeline, do you want to do two?
Okay, true or false, cutting down on table salt or eliminating it entirely from meals will prevent you from getting an excess amount of sodium in your diet.
Good job.
Question 3, true or false? If I take my blood pressure medication, I will be able to eat whatever I want. Okay, so which of the following are risk factors for hypertension? Select all that apply. So I'll just kind of go one by one and you guys tell me yes or no. So under age 60.
Is that true?
Actually, over age 60 is a risk factor. So that one's not necessarily a risk factor. Insufficient dietary sodium. Is that a risk factor, yes or no?
That one, insufficient means you're getting
Not
less
enough.
sodium.
So that's
So-
not a risk factor
See,
either.
I'm making it tricky for you. I wrote these questions, so they're not going to be like, you know.
Okay, so smoking, is that a risk factor? Correct. Smoking's a risk factor for everything, like she
Yes,
said.
Terrible, terrible.
Okay, a family history of CV disease, which is cardiovascular disease. Yes, okay. Being too active. Good job. Obesity. Yes. Excess alcohol. Yep. And what about race? Good job. Actually, African American race have the highest blood pressures around.
Yeah, it's
More of a risk factor to be
in fact,
African American.
sometimes they'll even be prescribed different medications just because of the body chemistry. They're more predisposed to have high blood pressure,
do.
and
Can you
the
do
way
it?
it's
I don't
treated
even know
with
what
drugs
this word
might be a
is.
little bit different
Here, I'll do it.
than other ethnicities. So something to be aware of.
Okay, so now which of the following could occur due to high blood pressure? So I'll do kind of the same thing again. Damaged arteries? Yes. Halitosis. Before anyone answers, does anyone know what that means?
I don't.
Halitosis is bad breath. It's a buildup of bacteria that causes bad breath. So now that you know what it means, what do you think? Can that be caused by blood pressure? High blood pressure?
Okay, nonverbal cue.
No.
Do you think it could be?
Was that you? I don't know. Or was that you?
I guess maybe somebody else's bad breath could give you high blood pressure.
It looks like such an official word.
I told you, we're
We have a
making this
medical word for
easy.
everything, but.
All right. What about scarring of the kidneys? Yes. Sexual dysfunction? Actually, yes. High blood pressure can cause sexual dysfunction.
Yeah. Now everybody's interested.
We want to know.
We'll get into it.
Of course you do, Bobby.
All right. What about baldness?
No.
No. Permanent vision loss
Yes.
Yes.
and stroke.
Yes.
Correct.
Yep. Okay, which of the following interventions can reduce the risk of hypertension? So does regular exercise reduce the risk? Correct. Weight loss? Yep. Stress management? Reduced sodium intake? Smoking cessation, meaning stopping smoking? Avoiding excess alcohol consumption, like drinking a lot? Doctor prescribed medication? And monitoring? Okay.
Okay, does anyone know the upper limit for normal blood pressure?
Like the top number.
The top number before you have pre-high blood pressure.
Should be 70.
So you want the higher number of the two goes on the top. The systolic is the higher number,
And diastolic
is the lower number. So, sorry? 129 is what is 129? Yeah, we can cheat. Pre-hypertensive, no. So we want everyone to be between 110 and 119 over the diastolic number, which is 60 to 79. So the max we want you to be on any given day is 119 over 79.
119?
Yep, over 79, and that's high. So if you're at that number, you're almost at pre-hypertension, which means pre-high blood pressure. And then we start monitoring you, and maybe we're going to give you medication so you can be lower.
And a lot of times I'll hear people say that the limit is 120 over 80 just because those are easier to remember. But
Yeah.
Yeah, if you're at 120 over 80, you don't want to be anywhere beyond that because that's when you start getting a
If
little
that goes
bit.
by your body weight,
It really should be for anybody. Now, people that weigh less will probably have lower blood pressure, but there's really no reason that you would want anybody to be more than 120 over 80.
Yep.
Like some people say, oh, it runs in my family, so my blood pressure can run high, and some people have higher blood pressure, but 120 over 80 is the limit. So
Most people don't.
yeah, you don't want that.
Nope. Okay, so keep those quizzes. We're going to collect them when we give you the quiz after we talk about high blood pressure. Okay? Lots of questions today. Oh, I'm sorry, skipped one. Sorry, number 8. I currently have my blood pressure checked on a regular basis. So that's more for you. It's good to go to the doctor and get your blood pressure checked, particularly if you're over 60, because we know that's when it increases. Doctor? Okay, great. So if you go to the doctor, something they'll do routinely is take your blood pressure. So, yeah, and they will tell you if your blood pressure is too high, if they're concerned about it. So that's why it's good to go to the doctor. Okay, we're good to go? Okay, so now we're actually going to start the presentation. And obviously we're talking about high blood pressure. So that's what we've been talking about for 20 minutes. Okay, so...
What's that?
Oh, she's... Okay. So, blood pressure is reported using two numbers, systolic and diastolic. Systolic is the top number, so it's the first number that we give you, and it measures the pressure that the heart exerts while it pumps the blood. And so we know the heart is pumping, pumping, pumping to move the blood through the body so that all your tissues can get oxygen so we can function. Then the second number we give you is called the diastolic pressure, and it's the pressure that the heart exerts at rest. So, yep.
If you think about your heart, so systolic, diastolic, and when your heart's at rest, that number is really important. That's the number that you really don't want to have over 80, because if your heart's resting, you shouldn't have a high pressure in your body at all. So if you do, that's when we start to worry, because that's when damage starts to happen that we'll talk about later.
Okay. So we've talked about the normal numbers a little bit. The top number we want between 100 and 119, and the bottom number, so the lower number, we want between 60 and 79. If your numbers are above these normal numbers, you have something called pre-hypertensive or pre-high blood pressure. So that's when you go into the doctor, we measure, we say, oh, you're pre-hypertensive, and then we start monitoring you because we're afraid that you're going to get to the point where you're going to have high blood pressure, and then we have damage. So those numbers are 120 to 139 over 80 to 89. Then if you have high blood pressure, ooh, Earl, there's a lot on here. Okay. And I did read it. Okay, so there are 2 stages in high blood pressure and diagnosis of high blood pressure. So you can have a blood pressure that's 140 to 159. So if the top number's high but the bottom number's low, you can still have we can still diagnose you with high blood pressure. Or if the top number's fine but the bottom number's low, so if it's 90 to 99, then you can be diagnosed. Stage 2 high blood pressure is anything greater than 160, that's the top number, or the low number or the bottom number over 100. And when you have anything above 90, that's when we're really concerned that you're doing damage to all of the little arteries and the veins, like in your fingers, in your kidneys. That's when you start to get sexual dysfunction, which obviously is important, because the blood pressure is so high and the blood's being forced or there's so much force going into those teeny tiny vessels that you're doing damage to them. Okay? And then if you have diabetes or chronic kidney disease, you can run anywhere, or you can run between 130 over 80. Earl, do you want to talk about this one?
Okay, so what this one is,
I
as you
don't
get a
like
little
this.
bit older, there's also something called isolated systolic hypertension, which basically means as we get older, our lower numbers and our higher numbers sort of spread out a little bit. Like if I was 120 over 80, as I get older, maybe I would be 130 over 80. So my low number might stay low, but my high number might creep up a little bit. And just remember, the low number is kind of like your resting pressure, and that high number is the number that you're seeing when the heart pushes. So if those 2 numbers are spreading out, that means your heart's really like pushing a lot harder in comparison to your kind of your rest state of your blood vessels, and that can be a problem too. So you don't want those numbers to separate. I mean, they're going to start to spread out a little bit, but you wouldn't want them to separate by a bunch, because that means your heart's just beating with a lot more force than you really want. You don't want the changes in pressure to be that rapid or that pronounced. So the numbers should not be spreading out as you get older, but they will a little bit. So that's a good way. It's a good way as any to talk about it.
Yep. Okay, and we talked about this a little bit. So we know that risk factors for high blood pressure are smoking, alcohol, excess salt, diabetes, stage 1 or type 1 or type 2. If we see increasing blood pressure as we get older, so over age 60, you have an increased risk to have high blood pressure. If you're obese, and it's not necessarily just obesity, if you're over what your normal BMI is, you can develop high blood pressure or pre-high blood pressure. If you have a family history of cardiovascular disease, and cardiovascular disease is, simply put, it's when your vascular system or your veins and arteries, your vessels are hardened. And so it means that the heart has to pump that much harder to get the blood to your body. Okay? And then African Americans tend to have higher blood pressure than the rest of the population.
Okay, so sodium intake. The Mayo Clinic recommends limiting sodium to 2,300 milligrams per day or 1,500 milligrams per day for people over 51. African Americans, people who already have high blood pressure, or people with diabetes or chronic kidney disease. This is an upper limit, not a minimum recommended amount, and the American Heart Association recommends no more than 1,500 milligrams for anyone.
So there's a little bit of disagreement on how much you should be, but remember, this is an upper limit, so it's not like you're saying, ooh, I want to get to that 1,500. You don't need to worry about making sure you get enough sodium for 90% of the people in the world. You're going to get way more sodium than you need just by eating what you eat.
Yeah, anything.
Yeah.
And actually, this is so bad. So I have a bag of chocolate chips here. This is, after a good day of nursing. And you can get the sodium level, which is just the salt level, right on the label. So if you're calculating, if you think, or your doctor tells you you have pre-high blood pressure, I have high blood pressure, it's right there on the label under sodium. This has no sodium, so I'm good to go.
It's perfectly healthy in every other way too.
Chocolate
Right?
chips.
Yeah.
Okay.
But yeah, especially in processed foods, you know, like they add so much salt to it to conserve it so it'll last longer. And so that's bad, you know, so you have to really watch out for that salt. So you definitely don't want to get near that number. That's just like the upper limit, like Earl said. Okay, so sodium intake quiz. Keeping in mind the upper limit of sodium is 2,300 milligrams per day, how much sodium would you guess is in each of the following? So in 1 teaspoon of table salt, like how much do you think would be, how many milligrams of sodium?
We might have them like write it down.
No, we throw it out there. Just throw a number.
Just throw out a number,
And we'll tell you, we'll let you know.
like tens, hundreds, thousands.
800?
300.
Any other guesses?
Did you ask what was it?
How much would you think is in a teaspoon of table salt? How much sodium is in a teaspoon of table salt? So a teaspoon, about this much.
Don't look at the next slide.
Yeah, don't
It's not on the
cheat.
next slide. Don't cheat.
There is no next slide.
Oh, did they? No, it's on theirs.
Yeah, I know.
Yeah.
Yeah, a teaspoon of salt.
Little
Like how much?
teaspoon.
Like how much salt? How much sodium do you think is in that?
I say about 1,500.
1,500.
Okay. The answer is 2,325. So-
teaspoon of salt, you're over your limit. Just this much salt.
So if I go,
A teaspoon's the little one.
Right.
and then for half a cup of cottage cheese, how much do you think is
Don't
in
cheat.
that?
Yeah, don't peek.
I love cottage cheese.
I'm watching.
Yeah.
In the
Do you think
back.
it has a lot, a little, like tens, thousands, hundreds? Like how
I mean, you would
much?
think cottage cheese, it doesn't really taste salty, does it? I don't like it, I don't know.
Yeah, I don't either.
It doesn't taste salty? Okay, so how
Do you
much,
add salt?
what do you think?
Like 1,000?
1,000?
1,000?
What does it end up being?
It's actually 400.
400, but I wouldn't think there'd be any because it doesn't taste salty. It's like, it doesn't taste salty, so,
So that means I need to stop eating cottage cheese?
no.
No.
But just be aware
You
there's
don't
salt
eat
in
the
it.
whole
Everything
container.
is fine in moderation.
Yeah.
Yes.
That's the key. Don't eat a vat of cottage cheese, which I have seen in real life, by the way.
Okay, so 12-ounce can of Coke Classic. How much sodium do you think is in that?
A lot.
A lot?
500.
No, it's more than
Any more
I
guesses?
think they're lying.
It's like it's like
Say that.
2,000 salt.
No.
1,000?
1,000?
It's actually 50.
But I don't know. I looked on a couple different places, but I almost question that because pop seems like it would have all kinds of bad stuff in
But
it.
it doesn't have that much salt, but it has a lot of sugar.
Yeah.
Diet's worse than regular, right?
It's got bad stuff in it that we don't even know what it is. Nobody knows what it is.
It's
It's just
chemicals.
mystery stuff.
Sludge.
Yeah,
It's
right.
chemicals, yeah.
So McDonald's fries. What do you think about McDonald's
This
fries?
is a lie.
They're salty.
1,000? I like that answer.
It's more than 1,000.
What is the official?
2,000.
800.
What's the official?
It's actually 290.
I
Now,
think
I
they're
got that off the McDonald's website. So they're saying 290.
Yeah.
I think that's before they add the
Depends
salt.
on who putting it up.
Yeah, depends on who made it. Because I've got some pretty salty ones before.
Okay, so Campbell's soup, how many milligrams of sodium? Do you just want that?
Depending what kind of soup.
1 can.
That's true.
300.
300? Any other guesses?
400.
400?
500. With
500.
potato soup, it doesn't have no salt.
It's actually 800.
800.
So that's pretty salty.
I mean, you're thinking, oh, I'm on a diet. I'm going to eat some soup because it's a diet and soup is not that bad for me. But think about all the salt you're getting.
Yeah, again, it's
Condensed soups have lots of
Oh,
salt.
because it's processed food, so they have to add all that sugar so it can last, months, I think even year, right? That the last expiration date.
Yeah, they put salt and
So-
stuff to make it
Okay.
last, all kinds of things.
And then ranch dressing, a tablespoon of ranch dressing. How much sodium do you think is in
Big
that?
spoon, tablespoon. What do you
What is
think?
it, light or just a regular?
Regular,
I like light.
50. Any other guesses?
Let's say about 100.
About 100? It's actually 120, so that's pretty close, yeah.
Okay, and how many people stop with a little tablespoon? Because I use like half the bottle.
Yeah. And at restaurants, right? Sometimes you go to like a restaurant and like they just dredge on the salad dressing.
I do that every so
Okay, so yeah, those are
So
the,
there's the values for you.
okay, blood lipids. So certain fats, monounsaturated fats, polyunsaturated fats, omega-3 fatty acids, which are good, are actually good for you, or better for you. So saturated fats should be avoided as much as possible. And trans fat are extremely unhealthy. And I've noticed in a lot of restaurants they've actually eliminated trans fats from their menus. Can anybody think of like good fats? Like examples?
Sources of good fat.
Yeah. Like omega-3 fatty acids. Have you guys heard of omega-3s? Fatty acids in the news? Yeah, fish, peanut butter,
Yeah, nuts are really good source of fat, healthy fat.
avocados. Yeah.
And the reason we mention this is because when you have too much of the bad fats in your diet, they just kind of start plaquing on the insides of your arteries and making them even more narrow, which makes your blood pressure go up even higher.
Yeah, and it's how you develop cardiovascular disease.
Yep.
So watch what kind of fats you're eating. Look at the labels. You guys ever look at the labels?
No.
You should. Look at the labels.
Yeah, for sure.
See what you're getting.
Do you look at other labels?
I do.
I don't.
I ignore them sometimes, but
Okay, obesity. For people who were obese, one study showed that a 10% weight loss produced an average of 4.3 over 3.8 milligrams of mercury drop in blood pressure. So that might not seem like a lot, but that might make a difference. If you're pre-hypertensive, it can bring you down to normal. So just losing, 10% of your body weight can definitely help your blood pressure a lot.
And you guys are practicing math, so you can do 10% of your weight to figure out how many pounds that
we're
would
gonna
be.
do that later. Let's do that. You do percents.
Okay, interventions.
Okay. So, as we said earlier, the upper limit's 120 over 80. That's systolic over diastolic. And we mentioned lifestyle changes that you can make. Always with, in the medical field, we always want to prevent before we treat with medications. So to prevent high blood pressure, you can stop smoking, you can lose weight, you can fix your diet. Exercise is always important. I mean, you don't have to go to the gym for hours at a time. Even just doing chores at home or taking your dog for a walk or going and playing with your kids if you have them, like anything counts. Reducing your stress level, which is really hard to do in our world. And yeah. And then if we can't get your blood pressure under control with lifestyle changes and your doctor wants to put you on meds, usually the first thing they're going to do is a diuretic, which is a water pill, if you know what that is. It's just a med you take and it makes you essentially lose water, so you pee a lot. And when you're losing blood, when you're losing volume, there's less blood in your body, which reduces your pressure. There's a whole host of other meds, and a lot of the meds actually come along with negative side effects. So I know persistent cough is one of the side effects, and so it's better to lower it via doing this versus getting on a medication to do it.
So, you drink a lot of water that will reduce your blood pressure?
No, that increases your blood pressure. So you have high blood pressure because there's too much water in your vessels, in your vascular system. So if you have a ton of water there, it means the heart is pumping harder to move all that water through.
Yep. And salt, when you eat a lot of salt makes you retain water, which is why the diuretic helps you get rid of some of that water, some of that salt, to decrease your blood pressure.
But don't think you can just say, oh, well, I just won't drink very much water anymore, because
that's bad too.
that's not a good
That's
thing
horrible.
either. So you want to make sure
Yeah.
you're well hydrated. Really, just trying to say I'm not going to drink water would probably not be a good way to manage your blood pressure. It would be lifestyle changes, diet, exercise, things like that. So.
Yeah, sorry, I didn't mean it like that. You should drink the appropriate amount of water, but if you drink too much, then you retain too much salt, because water and salt are best friends, and they love being together. So that's why we don't want you to eat too much salt too, because then you retain water, and then your blood pressure goes up. If you drink too much water, then your body keeps the salt. So it's a balance. It's a balancing act. Yeah.
Okay, so if you have high blood pressure and you do get put on medications, there, as I mentioned earlier, there's a lot of side effects, and this just lists some of them. So impotence, does everyone know? Anyone does not know what that means? Everyone, what is it?
Impotence.
Impotence. Yeah, well, I say impotence, but basically it's you can't get an erection, and then decreased libido, so decreased sex drive. Orthostatic hypertension is the biggest and most worrisome side effect of the blood pressure, and what that means is, like, let's say you're sitting down, you're laying down, and you get up really fast. Well, your blood pressure is going to drop really low, and you're going to black out or pass out. So that's a really common side effect of blood pressure meds that we, if anyone's taking them, we tell them to watch out for. Alcohol and cold medications increase your blood pressure, and they can interact with the meds that you are taking and cause them to not be as effective, or vice versa. Also with your meds, if you have any side effects, you should tell your doctor as soon as possible. Don't just stop taking them, because that'd probably be worse than taking them. And then, yeah, don't ever skip a dose. And there's lots of them out there, so if you get put on one and you have a lot of side effects, your doctor can work with you to find a different medicine, different regimen, etc. And so these are some of the bad things that can happen if you decide, well, my blood pressure's high, but I'm not going to do anything about it. I'm going to die anyways, whatever. So you can have heart disease, and pretty much your heart it's just pumping so hard against all the pressure that it's just one day just going to say, I'm not going to pump anymore. CV disease, which we talked about. That's a stroke, so it's pumping so hard that all the blood vessels in your brain, they get tired and they get weak and they can leak, and then that causes a stroke. Peripheral vascular disease is just the hardening of the blood vessels in your body, like in your limbs and stuff, damaging them. Nephrosclerosis is damage to your kidneys, so you could end up having to need dialysis, which I don't know if any of you know anyone that needs dialysis, but it's not a fun process. Retinal damage, so you could go blindness, it could lead to blindness, and other complications include resistant hypertension and hypertensive crisis. So that's when your blood pressure gets up so high that you're pretty much going to die unless it's treated within hours. There's special medications for that they give you in the ER, but you don't ever want to get there. So I think we talked about this, but there's really no, you don't really know you have high blood pressure. Like, it's not something you can feel. Some people say that you can have a headache, but from my experience and what I've seen is that's not really the case. And if you do have a headache from high blood pressure, then it's already so high that you're probably going to hit that hypertensive crisis. Yeah, and this just mentions that by the time you start to maybe feel something from your blood pressure, it's too late. So, if you do have high blood pressure, as we've been saying, you should look at your diet. Everything is fine in moderation, but obviously the DASH diet is what we're told to implement now. It's lots of fruits and vegetables, fresh produce, lean meats, the packaged foods, the fast foods, all that stuff is really full of salt. It's really bad for you. It's bad for every system in your body. Exercising regularly, being at the right weight, controlling your stress, quit smoking. Like, I just tell everyone I know, quit smoking. Don't smoke, ever. Stop if you do. Watch your alcohol intake, and monitor your blood pressure is really important because, like we said, there's no symptoms you don't feel if you have high blood pressure, so it's good to know that where you stand and if you're going up or down. And then if you have high blood pressure and you are on medications, just make sure you take them regularly and follow up with your doctor. Okay, so now we've talked to you guys, talked your ears off.
Oh my gosh, another quiz?
And taught you.
Don't use your
Earl's
PowerPoint.
idea, wasn't it?
Cruel.
We'll see what you learned.
So try not to use your PowerPoint. Just use what we taught you.
Great. I don't know who's doing this.
And if you get a better score in this quiz, everybody gets a free bottle of table salt to leave with.
Or a donut.
Right, a donut with salt on it.
Yeah, so we're gonna collect the pre-test and the post-test, so. Our records. And then we actually, oh, Earl, we printed to it.
I did.
Do you wanna keep recording?
Do you want to look at one? Are you okay? You okay?
So, well, I guess I was gonna ask you any questions, but I guess we should wait till